Good afternoon, everyone. Thank you for joining us today for this webinar on dementia, caregiving, and transportation. My name is Julie Dupree, and I am with the National Aging and Disability Transportation Session. I have a few quick housekeeping items that will make your experience today more enjoyable. We are delighted that you all are with us today to address this important topic, and we look forward to having you a part of this webinar. A couple quick housekeeping items, as I mentioned. Before we get started, this session is being recorded and will be available as an archive on the NADTC website. Closed captioning is available for today's session, and you can access captioning by clicking on the CC icon at the top left of your screen or by using your keyboard command Control and F8 together. And we would like to thank our captioner for being with us today and providing this valuable service to us. If you're having any difficulty with Blackboard or any technical components of the webinar, you can contact Blackboard Technical Assistance or email contact@nadtc.org, and we will do our best to troubleshoot any problems you may be having during the webinar. One other thing before I turn it over to our moderator today, to submit questions, which can be done at any point throughout the session, you can either enter your question into the chat box if you're in Blackboard, or you can email your question to contact@nadtc.org. A quick reminder that the chat section is public, so if there's a question you'd like to ask in a more private manner, I would encourage you to use the contact@nadtc.org email. And we'll address as many questions at the end of the webinar as time allows. And if we don't address your particular question during the webinar today, we will follow up and NADT staff will provide technical assistance to you to address your question after the event is over. So again, before I turn it over to Virginia Dice, who is our moderator for this session today, I'd like to do a quick poll. And the poll is just one question. And that question is your work primarily on dementia and caregiving, or transportation, or all of the above? And to answer this question, on the top left of your screen in Blackboard, there's a little box that has a lowercase a in it that enables you to respond to the poll. So again, if you do work in transportation, or if you do work on dementia and caregiving, press A. If you do work on transportation issues, press B. Or if you do work on all of the above, dementia, caregiving, and transportation, please hit C, and we will publish the results shortly. And with that, I'd like to turn it over to Virginia Dice, our moderator.
Thank you, Julie. Good afternoon, everyone. Welcome to this webinar that is sponsored by the National Aging and Disability Transportation Center. We're very pleased today to have a really well-informed expert panel to share their knowledge and experience with us today. So I'll kick things off. As you can see, I'm the co-director of the National Aging and Disability Transportation Center, and I work here at N4A, the National Association of Area Agencies on Aging. I'll be talking a little bit about the NADTC and our work in this area, and then I'll turn it over to Meredith Hanley, who is the director here at N4A of Community Capacity Building, and she also leads our work on Dementia Friendly America. Following Meredith will be Greg Link, who directs the Office of Supportive and Caregiver Services at the U.S. Administration for Community Living. And then we have, I think, a really important aspect of this webinar, because we know that there are a combination of folks here who are participating with us who come at this from the caregiver or the dementia arena, and that's what your work has been. And so Steve Yaffe, who is a transportation consultant and recently retired as transit director with Arlington County, Virginia, will be talking to us about the role of public transit and paratransit in serving individuals with dementia and their caregivers. And he's going to really, I think, do an overview of some of the options to consider that may or may not be available in your community. But I think this educational component of this is really a critical part of our discussion today. And then we'll be following that with a presentation from Dr. Claudia Thorne, who is State Coordinator in Maryland of the Dementia Friends Program, and is also a professor, an assistant professor at Coppin State University in Maryland. So with that, let me move on, and hopefully we will have some time for some discussion. And as Julie mentioned, if we don't get your question today, we will hope to respond to that question at a later point, and offer you the opportunity also to send an email to contact@NADTC.org to ask a question after the webinar as well. So moving on, I want to just mention why we here at the NADTC thought it was important to make this connection, or to start talking about the connection between transportation and caregiving. We know that about 60% of people with dementia in the United States are living in their own homes and communities. Many of them have caregivers. There are 44 million caregivers in the United States. And we know that an important function of caregiving is either providing or arranging transportation. On average, about 78% of caregivers actually fulfill that function. And as you can see, there are some real differences. Among Asian Americans, 9 out of 10 caregivers actually help with transportation. If people are white, about 78% of caregivers help with transportation, and 72% of African American caregivers help with transportation. And there are, I'm sure, many additional nuances and differences among that population. These are averages. But we know that providing transportation can be a very heavy duty and one that takes a lot of time. We also know that, unfortunately, only about 23% of caregivers have used any formal transportation services. I think pointing out the importance of educating caregivers about options that may be available to help them in the community. Next slide. So for those of you who are unfamiliar with the National Aging and Disability Transportation Center, let me just say that the big focus of our work is all on accessible transportation for older adults, people with disabilities, caregivers, and communities. Most of our work is with professionals in the field and with communities. And we work with disability organizations, we work with aging organizations, we work with public transit, as well as other transportation providers. Primarily, those of our target audiences. We have a relationship with the elder care locators, so that if people call our toll-free number and they have a question, they are looking for a ride right away, we connect them right away and really seamlessly with the elder care locators, so that they can in turn connect the caller with local community resources. We do a lot of training and webinars and online courses. We have a partnership strategy because, like you all in the community, we recognize that transportation covers a lot of different arenas. The healthcare arena is an isolation area that affects so many older adults and people with disabilities, and caregiving. So we do spend a lot of time and energy developing partnerships. We also invest in community solutions, and I want to point out a couple of opportunities that we include on the slide. These are live links to our second annual photo contest. If you go to our website at www.NADTC.org, the hero photo at the beginning of our website was the #1 winner of our photo contest last year. And we use those photos in our publications, and they're scattered throughout our website. So we're very proud of those, and we're doing a second annual competition that closes on May the 18th. Finally, I want to mention that we have a grant announcement that we just published last week, Getting Ready to Innovate. Those are planning grants of $20,000 each. We hope to fund up to 10 communities. Those applications are due on May 31st. So if you go to our website, you can find out more. Next slide. So in terms of the work that we have embarked on in the area of dementia, caregiving, and transportation, we have a couple of important objectives. One is to really do an in-depth look and explore this area that we think has been underexplored. And people don't say these words, dementia, caregiving, and transportation, usually in one sentence. So we want to explore that, learn more, and hopefully educate folks about opportunities for coordinating those important services. And finally, to provide guidance to communities on how to do that. On the right side of this slide are a couple of recent publications, including a brochure on dementia, caregiving, and transportation that we're particularly proud of. Those publications are available on our website. Next slide. And finally, I want to talk about some of the things that we have done up to now. We at the NADTC have developed a working relationship and partnership with Dementia Friendly America. We did an online course that began last December and ended early in February on this topic. And as a matter of fact, a couple of our presenters were part of our faculty for that online course, including Steve Yaffe and Dr. Thorne. And from that course, which there were about 130 registrants in the course, we have developed a toolkit. Now that toolkit includes links to all of the PowerPoint presentations, and access to a video from a meeting that we helped convene in Prince George's County, Maryland last December that Dr. Thorne is going to be talking about later in this webinar. So all of that information is accessible through the toolkit, and the toolkit is really a work in progress. We hope over the next few months, as we continue to work on this important issue, that we will be improving the toolkit. Finally, for those of you who are coming to the N4A conference in Chicago at the end of July, early August, we will be doing a pre-conference intensive on this topic on July 29th. With that, what are the results of our poll, Julie? Okay, I'm struggling to read it. So in the area of dementia and caregiving, it looks like about 7% of you all work in that area. About 20% work in transportation. And about 13% of respondents, of which there are a total of 59% of you all, have responded that you work in those arenas. So that's really great to know. Thank you for responding to our poll. And with that, I will turn it over to Meredith Hanley.
Thank you, Virginia. My name is Meredith Hanley. I'm the Director of Community Capacity Building with the National Association of Area Agencies on Aging and serve as the project lead for Dementia Friendly America as well as Dementia Friends USA. And as Virginia mentioned, we recently partnered, DFA partnered with the National Aging and Disability Transportation Center, as well as with dementia-friendly Prince George's County to convene a local meeting with a focus on transportation and how to best serve individuals with dementia and their care partners. And that's really what Dementia Friendly America is all about. We're on a mission to foster dementia-friendly communities across the United States. And we now work with communities across 40 states that are engaged in the Dementia Friendly America network of communities or beginning the process to get involved. So I'll just provide a little background on how the Dementia Friendly America movement began. Dementia Friendly America was launched in 2015 at the White House Conference on Aging. The White House Conference on Aging really served as a platform to scale up work that had already started in Minnesota years earlier in a program called the Act on Alzheimer's Initiative. And in that program in Minnesota, they worked with communities across the state to become more dementia friendly. And we really took that model and made it available nationally with a lot of resources to help communities engage in this work. So in 2015, we started with just a handful of pilot communities across the country. Prince George's County, who we'll hear a lot more from later, is one of these initial communities, and we couldn't be more proud of the work that they've done in helping Prince George's County to become more dementia friendly. And as I mentioned, there are now lots of communities across the United States engaged in this work. The National Association of Area Agencies on Aging does administer the program, and I just want to briefly mention Dementia Friends as well. Claudia Thorne is the lead on that for the state of Maryland. That is a program that's all about public awareness raising aimed at a general audience with the goal of changing the way people think, act, and talk about dementia. You can become a Dementia Friend online or in person in states that have that initiative. And I provided links to our websites here on this slide, dfamerica.org, as well as dementiafriendsusa.org. So with that being said, what is a dementia-friendly community? Dementia Friendly America believes that a dementia-friendly community is one that's informed, safe, and respectful of individuals with dementia, as well as their families and care partners. And it's a community that provides supportive options that foster quality of life, such as transportation. So as we'll be discussing today, transportation is a really key element in dementia-friendly communities. And joining the Dementia Friendly America network means that a community is engaging in a process to become more dementia-friendly. Just a couple additional statistics, and Virginia had some great ones, and I know Greg will have some helpful statistics as well. This slide shows why demographically we think dementia-friendly work and dementia-friendly communities are so important, and how the Dementia Friendly America initiative can help support communities in their goals. As we know, the population's aging. Age is the greatest risk factor for Alzheimer's disease, and we know the number of people with Alzheimer's disease is growing. Right now, it's estimated that there are 5 million people living with Alzheimer's disease, and by 2025, so now less than 10 years away, it's estimated that there'll be 7 million people living with dementia, and that's a 40% increase. But not only that, people live with Alzheimer's disease or related dementias in their communities and in their homes. And many, in fact, live alone. That's estimated at 1 in 7 people with dementia live alone. So supporting individuals in their communities, in their homes, with services and supports is so essential. And of course, transportation is a really key element of that. And Dementia Friendly America is all about community impact. And so this slide highlights how communities work with broad partners to become more dementia friendly. Our belief is that every part of the community plays a role and can work together to take steps to create a dementia-friendly culture. So whether it's transportation, looking at how to best support people with dementia, or equip staff with necessary training or resources, or businesses supporting customers with dementia, or healthcare systems promoting early diagnosis and options for care, or communities of faith providing welcoming and engaging environments for people living with dementia and their caregivers. Every aspect of community really plays a role in helping a community to be dementia-friendly. And this highlights where we are across the country. As I mentioned, we started in 2015 with 7 pilot communities, and now there are hundreds of dementia-friendly communities or communities working on dementia-friendliness across the United States. And we work directly with communities across 40 states that are engaged in this work. And you can see the pins on this map of where those states are that we have those contacts, those communities engaging in this work. As I mentioned, Dementia Friendly America has a great website. It's dfamerica.org. Our role here at the initiative is to support communities that are engaging in this work. And so we do that by laying out a roadmap that communities can pick and choose pieces from. So we have a lot of tools, and we have a whole toolkit that groups can identify what resources are most helpful for them, and even customize and download our tools. They're pretty much all Word documents and there to be used and accessed. We also provide webinars and have a monthly newsletter, and really just encourage anyone interested in this work to check out our website, but also be in touch with us to discuss how we can support your efforts in this area. But next up, we'll hear from Greg Link with a federal perspective on resources in this area.
Thank you, Meredith, and thank you everyone for tuning into this webinar. It's great to be here. I am with the U.S. Administration for Community Living. I'm actually sit within the Administration on Aging, and my Office of Supportive and Caregiver Services has responsibility for administering a number of programs, including the Older Americans Act Title IIIB programs, as well as the National Family Caregiver Support Program, and our Alzheimer's disease demonstration grants, which I'll be providing a little bit more detail about in just a little bit. But I really appreciate the opportunity to provide some perspective on family caregiving. Former First Lady Rosalind Carter has been quoted as saying, there are only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And if this is true, and I suspect it is, at some point in our lives, I think nearly every one of us can expect to be impacted in some way and to some degree by the family caregiving experience. And that experience is unique for everyone who's touched by it. Family caregiving means something different to everyone. Family caregiving can range from the most simple to the most complex. As we see on this slide here, it can be as simple as calling a friend or a relative to see how they're doing, and doing so on a regular basis. It can be helping with or doing routine tasks for someone, such as grocery shopping, bill paying, household chores, transportation. It can be assisting with medications and personal care. And it can be as complex as and as heavy duty and intense as nursing and medical care and wound care. For a number of years now, the National Alliance for Caregiving and AARP have worked to better understand the family caregiving experience in all its diversity. Through their surveys, which are done approximately every 5 years or so, there's emerged a profile of what we can call, and I'm putting this in air quotes here, as typical caregiver. The profile that you get when you run the numbers on the more than 1,200 family caregivers who participate in their surveys, who tell their stories and share their experiences and their joys and their fears, and what their needs are and what the experience means to them. This national survey looks at the family caregiving experience, though, as it relates to children, adults, and older adults. So it is, in recent years, has become lifespan in its coverage. It also takes a look at segments of the caregiving population, which I'll talk about here in a minute. But when we look at the national numbers, we see that it's estimated that there's approximately 44 million family caregivers, as Virginia pointed out earlier. And when the results are all average, we come away with the profile of a typical caregiver that's on this slide. It's usually a 49-year-old female caring for a 69-year-old female relative that needs help with some type of a long-term physical condition. They provide care for an average of 4 years, doing so for about 24.4 hours a week. and they help with at least 2 activities of daily living and 4 instrumental activities of daily living, and I'll talk about those in a second. They're a high school grad with some college. Their average household income is about $54,000, and the care recipients either live with the caregiver or live close by, and they've been hospitalized approximately once per year. Now, while the study looked at caregiving across the age spectrum, it also provides focused looks at specific groups of family caregivers. And one group that they focused on were the caregivers caring for somebody age 50 and older, and that's where I drill down a little bit here on this slide. When we look at the numbers of family caregivers of adults age 50 and older, we see that there's approximately 34 million adults who've provided care to someone age 50 and older. And in line with the profile of the typical caregiver that was on the previous slide, again, most are female, and the average age of caregivers for someone age 50 and older is slightly higher. I think what's also striking is that nearly 8% of caregivers are older than 75 themselves, and so we're talking about getting into some fairly unique needs of both the caregiver and the care recipient. The fact that caregivers themselves in this age group could be in need of some assistance themselves. For caregivers caring for somebody age 50 and older, we see that approximately 24% are doing so for 5 years or longer. And for this population of caregivers, we see that memory problems like Alzheimer's disease and dementia are a bit more prevalent. When we think of caregiving and providing assistance to a friend or loved one, we often think of that in help in 2 areas. One with activities of daily living, ADLs, which are things like bathing, dressing, eating, and assistance with grooming and walking and getting about, those tasks that are associated with self-care, as well as instrumental activities of daily living like housework, managing finances, fixing meals, and transportation. Transportation, as we know, is one of the major areas where help is often needed and is often provided by a family caregiver. I think anyone who's worked in the field of human services, aging services, or disability services knows that transportation is critical. Without it, access to services and supports outside the home becomes increasingly difficult or sometimes impossible, as does access to opportunities to socialize and remain engaged in your community and to interact with friends and loved ones. The National Alliance AARP survey definitely demonstrates the prevalence of transportation as a key form of help provided by caregivers. And when you add dementia into the mix, transportation becomes even more important. From the standpoint of trying to locate assistance, transportation is one of those major services. The Administration for Community Living was established in 2012, and here I want to talk a little bit about some of the programs and services that we administer, and then look at them, take a little bit of a deeper dive into some of the transportation services that we provide. So ACL was established in 2012, and it brought together the Administration on Aging, which I'm a part of, the Administration for Intellectual and Developmental Disabilities, and the HHS Office on Disabilities. Now, since its creation 6 years ago, ACL has grown to encompass a number of other programs and initiatives working to help ensure that persons of all ages and disabilities and their families and family caregivers have the supports they need to remain independent for as long as possible. In a nutshell, ACL's mission is pretty simple. We work to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. For older adults and persons with Alzheimer's disease and related dementias and their family caregivers, in general, ACL administers a number of programs. In addition to the Elder Care Locator, which we fund the NCA to administer, and the Elder Care Locator sees approximately 20% of their calls each year related to transportation needs. But in addition to the Elder Care Locator, we also fund at ACL the National Alzheimer's Disease Call Center, which is a 24-hour information line that works to connect family caregivers of persons with Alzheimer's disease and related dementias to resources that can help address their support needs. The Alzheimer's Call Center receives in excess of 300,000 calls per year on issues and topics related to dementia, caregiving and services supports that are available in the community. In addition to the 2 call centers we fund, ACL also administers several programs intended to provide direct support to family caregivers. Under the Older Americans Act, we provide a range of services and supports under Title IIIB, which is our supportive services. Transportation is typically one of the most often used services under Title IIIB, and caregivers oftentimes turn to that Title IIIB program to assist them in meeting the transportation needs of their loved ones. Under Title IIIE, the National Family Caregiver Support Program, we provide a range of services and supports in 5 areas to family caregivers. And when we look at the broad service category in the National Family Caregiver Support Program, a service category called supplemental services, oftentimes transportation is one of the major needs and services provided. Title VI, which is our complementary Native American programs, offer a similar suite of programs for both older Native Americans as well as Native American caregivers, including the supportive services and caregiver support programs. We also administer out of my office the Alzheimer's Disease Supportive Services Program and the Alzheimer's Disease Initiative and Specialized Supportive Services Programs. These 2 programs work on building dementia capability, very similar to dementia-friendly communities, and oftentimes we see our grantees in either of these 2 programs administering elements of Dementia-Friendly America principles, and sometimes we're running these 2 efforts side by side. But the ADSSP and the ADI programs are working, like I said, to build dementia capability by replicating and translating evidence-based interventions for family caregivers and developing programs and services that can help older adults with or persons with dementia remain in their communities for longer periods of time. The ADSSP and ADI programs in 2017 served nearly 70,000 persons with dementia and their family caregivers. Every year, when we consider the services that are provided under the National Family Caregiver Support Program, the Older Americans Act requires that states and AAAs give priority to family caregivers providing care to older persons with dementia. And I could spend an entire 90 minutes talking about some of the results and findings from the various data collection efforts that we have underway. But I obviously can't do that. So what I want to focus on are just some key statistics to show that when we're looking at the services provided by the National Family Caregiver Support Program, we see that approximately well, first I'll talk about transportation services under Title IIIB, sorry. 5.2% of the older adults who receive transportation under Title IIIB have a reported diagnosis of a memory-related disease. And what I think is striking is that of that 5.2%, so 58% of those individuals live alone. And I think that has some important considerations when we begin thinking about service design and delivery and what the partnerships need to be at the community level for making those services happen. Now, of the transportation clients that have dementia, 64% use the service to get to a doctor or healthcare provider appointment. Not surprising, most of the transportation that's provided by the Aging Network is for medically related issues. 16% use transportation to get to shopping versus 35% who don't have dementia. And 51% report that they have family and friends help them arrange for services versus the 23% of people without dementia who are able to arrange for those services on their own. A couple of data points for the National Family Caregiver Support Program. Of the caregivers that are served by that program, 62% of them are caregivers caring for somebody with a memory-related disease, and fewer than 15% of care recipients, though, receive transportation, which tells me that caregivers are very heavily involved in their care recipients' lives with providing transportation. I think what I find surprising, though, is the high percentage of those transportation clients who live alone. And even though that might be a relatively small number, I think it begs the question, what extra steps do we as an aging services network and as providers need to do with things like outreach and identification? communicating the availability of services, with scheduling, with escorting, and having necessary backup plans in case of an emergency. I finally just want to point out a couple of resources that you might be interested in. We fund the National Alzheimer's and Dementia Resource Center. They have a couple of really great tools that you can look at and download. They're available to anyone on meeting the needs of people with dementia, particularly those people who live alone. And then I just also, again, want to point out the tremendous resource that we have in the NADTC. So with that, I will turn it over to Steve.
Thank you. Mobility is critical, of course, to maintaining one's independence and morale. And I want to use my time to talk about transit specifically because it really comes in a wide spectrum of services, from trains to heavy rail, light rail, bus, and smaller vehicles. This slide is concentrated on the bigger transit vehicles. Trains, streetcars, most bus services operate on regular routes, just serving signed bus stops as shown in the green line on the upper left. I want to stress that people with dementia, accompanied by caregivers and sometimes not, may be able to safely use transit, but bus drivers need training to assist someone with dementia who's riding alone, and I'll catch on that towards the end of my presentation. And as always, bus drivers take extra care to ensure that seniors and people with disabilities are seated before leaving the stop. Now, other varieties of transit are more flexible, such as the three examples on the right, from suburban Seattle, suburban Dallas, and Prince William County in Virginia. These allow the bus to deviate off route, and someone can be picked up or dropped off at an on-demand bus stop. To do that, to be picked up at an on-demand bus stop off the regular route, one would call the transit office, and the next available bus would be rerouted. And to alight at an on-demand bus stop, just let the bus driver know the destination when boarding. Now, on the second slide, we'll get into paratransit, a term basically meaning alongside transit. And paratransit consists of a widening variety of shared ride options, including human service agency trips such as adult day health care, as well as public DialARide trips, regular group shopping trips, and non-emergency medical transportation, commonly abbreviated NEMT. Paratransit service may be provided by dedicated small buses or minivans, taxis, volunteers, and now Uber, Lyft, and similar companies. Flex zone transit and microtransit, new terms that are popping up, cover neighborhoods that cannot adequately support fixed route transit. Now, to give you an indication of the economics of this, a bus route usually requires 12 boardings per every hour of service. And that applies to those shown on the previous slide. A flex zone service can work with 4 to 8 boardings per hour. DialARide and human service agency transportation that takes one from home to the destination can be maintained with just over 2 boardings per hour, though 3 is more sustainable. And I want to concentrate a little bit on microtransit because this local concept of service in the suburbs has potential to sustainably provide rides in those suburban neighborhoods by connecting residents with a transit hub as well as a nearby shopping center. And you'll see more of those being developed as time goes by. Now let me go into specific types of paratransit services, starting with adult day healthcare transportation, which is typified by hand-to-hand transport, where the transit provider arranges with caregivers to meet the driver and the rider at the building entrance on each end of the trip. Before those rides are provided, there's usually discussion with the adult daycare center to ascertain whether the rider lives alone and is okay returning to an empty house. Because if not, when the rider's picked up, the driver needs to make sure the rider has a house key. The client file should always have an emergency drop-off option if they have to have someone to receive them at home and that isn't possible. The transportation provider needs to know if the rider has conflicts with other riders or has a best friend riding. A seating chart helps keep people apart or together and a more satisfying ride for everyone. And we do have some riders who resist using seat belts or behave unsafely when riding. Best practice is to assign that rider to a bus with an attendant. Drivers and bus attendants, if present, receive training in disability sensitivity and passenger assistance techniques. Additional training in behavioral management from the center staff is also helpful. The next type of transportation I want to talk about is the Program for All-Inclusive Care for the Elderly, also known as PACE. PACE provides a comprehensive interdisciplinary medical and social service to certain frail elderly individuals who are duly eligible for Medicare and Medicaid benefits. This coordinated care enables PACE clients to continue living in their community rather than being institutionalized in their nursing home. Characteristics of PACE transport include that every bus has an attendant. The attendant goes into the house to assist the rider to put on a coat and observe the conditions inside. That's because the bus attendant is part of the care team that includes the staff at the adult day healthcare site. The team generally has weekly meetings to discuss how each client is doing. PACE provides rides to all supportive services, including medical appointments, therapy, and adult day healthcare. And again, PACE clients must be eligible for nursing home placement, but are given the supports necessary to continue living safely in the community, and the slide has a link to the PACE program. Now, ADA Paratransit is for those who are traveling within the transit service area but cannot ride transit for some or all of their needs due to a disability. If you're riding ADA Paratransit, you can ride for any reason you want. There's no restrictions on the purpose of the trip. But everyone goes through the local ADA certification process. Who qualifies? Those who don't know when to board, alight, or how to transfer between bus routes, as well as those who can't reach a bus stop due to a disability. Riders are expected to travel independently with assistance between the curb and the vehicle seat, and if necessary, also to and from the building entrance. ADA Paratransit services are not door-through-door. Unlike adult daycare transportation, there are no handoffs. The fare is expected when boarding. It's usually double the regular bus fare. Some systems do have a prepayment program. Every rider can bring a personal care attendant at no extra charge, but ADA Paratransit services do not provide bus attendants. And again, while ADA Paratransit does not prioritize certain trip purposes, they also tend not to provide special services for specific groups. Again, they don't provide escorted transportation or practice handing off a rider at either end of the trip. Now, I'll group several types together: DialARide, non-emergency medical transportation, NEMT, and group shopping recreational trips. These rides are generally booked 1 to 7 days in advance. Rides can be subscription, regular standing order. For example, a group shopping trip every Tuesday, pick up at 10 o'clock to go to the local supermarket. Usually with the same group of people riding every week, it becomes a social occasion as well as a necessary ride. Rides can be scheduled either by the desired pickup time or the desired arrival time. Service days and hours will vary somewhat between weekdays, Saturdays, and Sundays if available. Again, assistance may be provided either to and from the curb or to and from the building entrance. PCAs are welcome. Bus attendants generally are not provided. And again, fares are expected when boarding the vehicle unless there's a prepayment option. The exception is for non-emergency Medicaid transportation. Medicaid transportation rides cannot charge a fare, but the rides must be to an NEMT paid service or medical appointment. Please remember that nearly all the programs I've described are shared ride programs, not exclusive rides. By picking up and dropping off other riders on the way, more rides can be provided within budget. Now, from a transit point of view, what is transit's role in transporting people with dementia? Transit systems should always train their bus drivers to take notice. Is the driver dressed inappropriately for the weather or for the public? Does the rider seem disoriented to surroundings? Does the rider keep asking the same questions or have difficulty understanding simple directions? Does the rider seem frustrated? And does the rider know his or her destination? If any of these factors pop up, the driver should notify dispatch to express that concern. How does the driver respond, though? Well, we train drivers to be calm, friendly, provide good customer service, to be clear and concise using short sentences as they calmly respond to questions, and repeat answers if necessary. Most bus systems, or a lot of them, have annunciation that announce the stop before the bus gets to that stop. Some bus systems still don't have that. In either case, the driver should remind the rider of the upcoming stops and be assuring that, yes, I'll remind you when we're getting near the Walgreens. The driver should be patient and reassuring. And again, if something pops up, if there's that concern, the driver should notify dispatch of the rider and where that rider leaves the bus. And as always, the driver should ensure that seniors and people with disabilities are seated before leaving the stop. And I just want to close by emphasizing transit is accessible, and there's many types of transit to meet people's needs, to meet the abilities that they have to continue to travel. Thank you. And now I'd like to turn it to Dr. Thorne.
Thank you.
Good afternoon, everyone. It is an honor and a privilege to be here today to speak about dementia, caregiving, and transportation in Prince George's County, Maryland. My intention today is to share with you a model that we utilized in Prince George's County, Maryland in December 2017 to host a convening of all stakeholders who are interested in dementia, caregiving, and transportation. The purpose of the convening was to design a replicatable, community-based model approach for bringing together all stakeholders. How do we have a meaningful and thoughtful conversation that explores dementia, caregiving, and transportation? An integrated conversation because the areas, the concepts are interrelated. Our goal is to raise awareness about the issues, to have an ongoing dialogue, to improve and expand transportation systems. As you can see, our flyer that we use to advertise this particular conference, the faces are smiling. They're happy faces because we are dementia friends, we are dementia friendly, and our goal is to provide hope and support. I'd like to put Prince George's County in context. The county is right outside of Washington, D.C. The land mass is 499 square miles. The population is 912,756. There's 65% Black African American, 26.5% white, and 17.8% Latino. There are 12.3% persons who are living over the age of 65. Once again, our convening are the stakeholders, and we provided a forum to explore the current state of transportation for persons living with dementia and their care partners. We were very interested in the lived experience of care partners and persons living with dementia. We wanted to hear firsthand. We wanted to identify existing resources in the public and private sector so that we can continue to dialogue and to work with transportation resources to ensure that the services that are provided are more dementia friendly. We want to stimulate interest to improve the dementia friendliness of the current transportation system. And we at Prince George's County, we are very proud of what we do. We were one of the first dementia-friendly communities, Our county executive, Rashawn Baker, has a personal interest in this area, and we wanted to share the good work that we're doing with the rest of the country. So we're proud and we wanted to tell our story. So looking at our story and looking at our story within the context of best practice, and we wanted to look at what we do within the context of the 5 A's of dementia-friendly transportation. Those 5 A's are, number 1, are the services that are provided to people with dementia and their family members, are they available? And are the services that are offered, is it promoted as supportive transportation? So that's number 1. Number 2, acceptability. Are services acceptable to people with dementia and their family members? Are the special needs attended to with respect towards mainstreaming them into the transportation system? Number 3, are services accessibility? Are services easy to use because we offer supportive assistance and we get people where they need to go? Number 4, are services adaptable? Can services be adapted to meet needs? And can services accommodate the needs of schedule reminders and help at destinations? And number 5, are services affordable? To what extent are services that are offered affordable for people with dementia and their family members? Are services that are offered, are they low cost, and are they financially sustainable? This is the standard for 5 A's in dementia-friendly transportation. So we started our conference that was attended by a lot of people with panel presentations. And the panel presentations lasted 5 to 7 minutes each. And the panel presentations consisted of transportation experts, persons from the volunteer sector, the local government, as well as the Metropolitan Area Transportation Authority. And we wanted them to really look at and explore what are the transportation resources for persons living with dementia and their care partners. And also, as part of this panel, we had one care partner and one person living with dementia to really talk about, from their perspective, how does transportation as an essential service impact the quality of their life. We started our conference with the voices of persons living with dementia and care partners because we believe that they are the one care partner said, "Mom cannot travel by herself. She has to have someone with her. I take her to her doctor's appointments and anything else she wants to do. She wants to stop at the grocery store. She goes to church every week. She goes to the hairdresser. It is important that she maintains her quality of life." This particular care partner said that sometimes transporting her mother is an all-day enterprise. A person who is living with dementia stated that I have a support group, and I'm grateful for that. I get around by Metro Access, and if I did not have the Department of Aging helping me, I would be in my house. I would not know what's going on. I still feel relevant, which is very important to me. Really important to emphasize these voices and to hear these voices, because transportation is not just about, although it's important, medical visits. So our transportation experts that presented included a person who led volunteer transportation programs. The volunteer sector is very important because it is local, volunteer-led, grassroots, neighbor helping neighbor. Community, they are very community-oriented and very geographically focused. And transportation information helplines are also provided as a part of this. Sarah Fott really talked about the support that's provided through the Village Network. There are 200 villages in the United States where we are really looking at people helping individuals on a one-on-one basis. The Department of Public Works and Transportation in Prince George's County described the services that they provided. These services include, and that are highlighted, are trips to seniors and disabled persons. They also included senior transportation services related to nutrition destinations, medical program service, and other program-specific transportation support. The county also offers Call a Cab and Call a Bus. And the next transportation resource within the Prince George's County area is the Washington Metropolitan Transportation Authority, and WMATA operates Metro Access, which is the ADA-compliant public transportation system. The cost was described, the procedure for making appointments, and the other services that are offered through WMATA, which include travel training to help people understand the existing system, and also the assurance of safety that there are training requirements for Metro Access drivers that include background checks. WMATA offers door-to-door services, and it allows a personal care assistant as well as companion care. So to move on to our focus groups. Our focus groups asked 5 basic questions, and those questions provided the opportunity to delve more deeply into the 5 A's. Focus group question number 1, where are persons with dementia and their care partners traveling to? Question number 2, what types of transportation are utilized? Question number 3, to what extent are transportation services dementia-friendly? Question number 4, what kind of supportive services are needed? And number 5, we really wanted to hear from the people who were attending the conference, how can the current system be improved? The focus group, if you're going to do this at the local level, it's really important to establish and set the tone for the focus group to have very open conversations, very authentic conversations, and very honest conversations, where there is, of course, voluntary participation. All of the focus groups participants are allowed to express their opinion with the understanding that there may be differences of opinion, but the listening is respectful. We wanted to keep an open conversation going and very fluid, as well as a focus in on transportation, because whenever caregivers come together, it's an opportunity to talk, and we can talk about a lot of things. But the focus of this particular focus group and this convening was on transportation. So the focus group leaders set the ground rules and expectations and told people what would happen next over the next hour. We also provided notes and tablets to record the sessions. The focus groups were comprised of approximately 8 persons in each focus group. So the destination, the most popular destination for caregivers and persons with dementia are medical appointments. People do spend a lot of time going on doctor visits, going shopping, grocery shopping, church, not just church on Sunday, but there are weekly church activities, there's daily mass. The other destination was social, leisure, and recreation activities, exercise, going to medical daycare, banking, the hairdresser, and the barber. In this particular Prince George's County region, the destinations are not just located in a very small neighborhood. It can include a tri-state area, which includes Virginia, Washington, D.C., and Maryland, as well as out of county. So that makes getting around a little bit more complex because it is a driving city. We found with the destination is that people with dementia may have very different priorities than their caregivers. The persons who are living with dementia are very much interested in visiting their friends and going to the hairdresser and having social interactions. Their priority is staying active and relevant and connected to the community. For persons with dementia, they really depend on an extended family network because their families may or may not live close. They also recognize that they need support. For caregivers, the focus is more the business aspect of getting people where they need to go. So that's the destination. People who are living with dementia and their caregivers, they're going to many different places. The utilization. Transportation, like every other aspect of caregiving, families provide more care than any other resource. Families and extended family members are the most important resource in transporting family members along with friends and extended family members. And there are many individuals who are living with dementia in the early stages of dementia who are still driving. As people move more deeply into caregiving, the demands for transportation support grow, and many individuals who are caregivers find themselves adjusting their work lives to either ensure an early retirement or they move into consulting so that they have the flexibility that is required to take their family members where they need to go. Transportation is very time-consuming. There's metro access, and sometimes that takes 14 days to schedule. The schedule is often filled. And as I mentioned earlier, people are utilizing Cola Bus, Cola Cab, veterans transportation services, private cab services, wheelchair-accessible cabs, ambulance, and volunteers. There are challenges in utilizing all of these systems that are related to scheduling, costs, crossing geographical boundaries, and the limits of availability in certain regions of the county. Because Prince George's County is very large, there are certain municipalities that may have their own transportation systems with varying costs. What about supportive services? As I mentioned earlier, family and friends are providing backup driving support. They're providing most of the support. And when they're not available, a backup transportation system is needed to support their loved one with dementia getting to where they need to go. And while people do know about the transportation resources that are available, the information needs to be more centralized and broadly disseminated. There is also the need for a person to have a non-medical companion or aide who is going along to provide care and to support travel. If the caregiver needs to take a break, what does one do? We also looked at having a travel kit to make the journey successful. And that travel kit consists of emergency contacts, a list of doctors, incontinence products, and medicine. Also, we want to make sure that people who are traveling come back. Caregiving is very, very complex. It involves multiple persons, it's intergenerational, and there are certain risks to caregiving, and it's important for caregivers, because caregiving is very stressful, including the transportation component, to provide self-care and to get involved with self-care. So the dementia friendliness of the system is that we found that some transportation workers are knowledgeable and compassionate, and transportation can be improved by providing training on how to work with persons with dementia to enhance the dementia friendliness of the system, and affordability is an issue. The recommendations for improvement include providing financial support, affordable transportation options, and more information on services that are available. For metro access, we wanted that was the recommendation to expand scheduling and access, to reduce trip time in scheduling clients, and to have frequent communication updates. And also in this very fluid geographical area, we wanted to make sure that there were fluid boundaries to improve access. For the Call-A-Bus program, the recommendation, of course, is to expand it, and there's also the possibility of charging a small fee. Extended hours would be helpful, shortening the length of the time for multiple passengers with prompt pickup and drop-off. For information dissemination, because there's so many different organizations that are involved with transportation, we really wanted to look at centralizing and distributing transportation resource information to various support groups, senior buildings, and senior centers. And more information is needed on available transportation resources and services. And customer service becomes really important. We want to be able to provide van rides to assist drivers in providing door-to-door versus curbside service. We wanted to provide support at drop-off sites when care partner parks their car and cannot leave the person with dementia unattended. We want to it's also recommended that we train transportation workers on dementia to develop their capacity to provide dementia-friendly services. So it was a very rich conversation, and some work has already started and was ongoing prior to the conference and is ongoing as a result of the conference to improve the dementia friendliness of the transportation system in Prince George's County. In the city of Greenbelt, they just recently hired, as a result of the findings of a senior mobility and accessibility needs and barriers study, they hired a mobility manager, a part-time mobility manager, to assist with transportation for seniors and persons with disabilities. And Prince George's County government is beginning conversations with dementia friendliness on exploring dementia awareness and sensitivity training for its workers. And then to support you, should you want to, and we hope that you do, want to convene a similar conference, is a list of tasks that we engaged in. I'm not going to go through all of the tasks, but what I do want to say, one of the greatest incentives that we had is that, number one, we provided lunch, and we provided on-site respite care, so that caregivers who are don't have a way of coming out without someone providing care for their loved ones, we were able to provide respite care on site, as well as transportation vouchers were provided for the county as an incentive. So I thank you, and moving forward, let's go.
Well, thank you, Claudia. This is Virginia again. I really, our partnership and our working relationship with Prince George's County has just been really exciting, and we look forward to continue to work in partnership and support with them because we recognize that A community meeting, which takes a lot of work, and it takes resources, and it takes planning and time, but it can just be the beginning of, as they say in Casablanca, the beginning of a beautiful friendship. But it does take time, lots of time. In Prince George's County, a lot of the folks who were involved in this effort are either volunteers or family caregivers or both. And recognizing that not everyone has the luxury of taking off and spending half a day to plan a meeting or to develop an ongoing working relationship. So it is going to take time, it's going to take hard work, and it's going to take persistence to keep things going. It's also important, I think, for everyone who is engaged in this work to really have a clear sense of how they want to see their community improved, how they want to see changes that really do impact the lives of older adults and people with dementia, as well as their family caregivers, as well as the system of services that are so important for supporting them to live in the community. So if there are opportunities like grant funding opportunities such as the NADTC grant opportunity or regular funding cycles that you can become a part of, like for example at the local level, the Transit Human Services Transportation Coordinated Planning process that is essential for drawing down some of the federal funds, particularly those that are focused on serving the needs of older adults and people with disabilities, the ever-popular 5310 program. And are there opportunities to bring in new supporters who can help work on this effort? So we think it's an exciting effort, but we know it's not going to happen overnight. We do also include in this PowerPoint package links to all the resources that we mentioned. I do want to say that the Dementia Caregiving and Transportation Toolkit includes a reference, a link actually, to a report that Dr. Thorne did on the meeting in Prince George's County. It's a tremendously important resource. And finally, we are now finally at the point where we can talk with you all and open it up for questions. And I know that we've gotten a couple of questions already. Greg, could you read the question that came in, I think, to you, or maybe Julie, you could read it and get Greg to discuss.
Sure. So the question that I received was regarding ACL and OAA participant surveys. How many survey responses were there, and can you provide a link to more details on the survey and the data? So the National Survey of Older Americans Act participants surveys separate groups of service recipients, those who receive case management services, homemaker services, transportation, nutrition, and then the caregiver program. And we have different sample sizes in each of those groups. I don't know how large the transportation sample is, but I would imagine it would be in the neighborhood of 11 to 1,200. The caregiver sample size is about 1,700, I believe. And you can access all of the survey results are publicly available on ACL's website. You can get to it from the main acl.gov website, or you can go to agid.acl.gov, and that takes you to our data warehouse, and it has a lot more than just the national survey data. You can pull down administrative data that's provided to ACL from the states, as well as census data and ombudsman program. It's pretty comprehensive, and it's all publicly available.
Greg, and I think we also have a question that was directed to Steve. So I'm going to move the phone so that Steve can ask the question.
Sure, and the question for Steve was, you mentioned things that bus drivers should look out for when someone might have dementia. Have you trained transit staff on interacting with people with disabilities? And they said it's something we would like to do with the age-friendly Boston plan.
As transit service manager and in my previous positions, I reviewed training programs for contracted services. And training programs generally include, well, I insist on a third factor, but let me go through all three factors. Best practice is to include a trainer in the program with a disability to sensitize new bus drivers as to the mobility needs of people with physical disabilities, sensory disabilities. There's lots of invisible disabilities, some of which may be cognitive. Within that, there's a second component of any good bus operator training program, and that's behavior management. The bus drivers should think of themselves as, for those who remember bad situation comedies of yesteryear, they should think of themselves as a love boat captain. Captain of the ship, but a calming influence. So they need to be trained, if you're faced with a situation, don't escalate it, be calm. Speak slowly and to the point. Repeat if necessary. This is in addition to all the other training, including handling the bus, smooth driving, again, not hitting the gas until seniors and people with disabilities are seated. I should have mentioned that there is priority seating behind the driver on every bus. That's federal law. And then the third component is something I learned from Houston Metro. And that's because best practice is to have monthly all-hands-on-deck training, refresher training for everybody. And we did this every year, focused on people with disabilities, and we would bring in riders with disabilities. Riders with physical disabilities, sensory disabilities, and visible disabilities. We were trying to, the last session we wanted to enhance, as you indicate, for behavioral issues that not necessarily age-specific. And that's still something I'd like to work on. And the usual format is they start speaking, thank you for what you do every day. It's so important for me to get around. I need this ride to get to the job, to get to the grocery store, etc. So thank you for kneeling the bus. Thank you for deploying the ramp. Most buses are low floor these days, and so on. And then get into Q&A. And some of the questions and answers are pretty interesting, especially since the labor force that I last worked with was primarily foreign-born. And it was pretty interactive. But it gets to a meeting of the mind so that there's a mutual understanding of the importance of what we do.
And this is Virginia again, and we have another question. It's a question about partnership and how the partnership with the National Center for Mobility Management and or travel trainers been explored to help address the objectives listed as well as assist with coordination with this project. And I can say that the NADTC is one of 4 centers that are funded by the Department of Transportation, including the National Center on Mobility Management and the National Rural Transit Assistance Program, and also the Shared Use Mobility Center. So we are in constant communication with one another. We share notices about what's going on in the various centers in our different newsletters. And the Federal Transit Administration periodically convenes all of us to talk with one another to ensure that our work is complementary, that where there are opportunities for us to work together, we are well aware of it. For example, every other year, National RTAP, which is the National Rural Transit Assistance Center, holds an annual national conference. It's not annual, I'm sorry, it's a semi-annual conference. And those of us who are staff to NADTC participated in that. We have funded projects that are focused at the local level on travel training, and we have utilized the resources that are available through our NADTC. And something I failed to say, and I'm very sorry I failed to say it, is that NADTC, and hopefully you saw it on with our logo, we are a partnership between N4A, which is where I work, this is Virginia, and Easter Seals, which is where Julie works. And we work together very intimately and closely, and actually Julie Dupree is a nationally recognized expert on travel training, and Easter Seals has a curriculum that lots of local communities have adopted on travel training. So yes, partnership is something that we try to ensure always happens at the national, state, and local level wherever we're involved. So thank you for that question. And we've got another question. So during transport, I had a situation where a client had to go to the bathroom. So the driver stopped at a rehab hospital en route to the care facility and had the security guard watch the other passengers on the bus while he took the passenger to the bathroom. Is this acceptable, or should we require an aide to be on board during the trip that is trained in dealing with passengers with dementia care? And Steve, I'm going to stick you with this one because you're the one with the most practical experience on actually running a transit and paratransit program.
I want to congratulate that bus driver for thinking on the fly and coming up with a quick solution. And bathrooming actually is an issue when scheduling rides, so giving people an opportunity to go to the bathroom before being picked up is key, something to be worked out with caregivers. Is this acceptable? Not on a regular basis. Where I last worked, we served 2 adult daycare centers. One of them specialized in early Alzheimer's. And frankly, best practice would be to have an attendant on that bus. It depends on the nature of the people with disabilities whether an attendant is required. If there's a behavioral issue, bathroom issues usually can be managed with some foresight. But best practice really would be to have an attendant if there's going to be a potential of a behavioral issue. And that's not just adult daycare, that's also people with severe intellectual disabilities.
Thanks, Steve. And I will say that there are some local programs around the country that have some good practices in this area. For example, out in a rural area, and some of you may have heard me mention this before because it's a program that we worked with last year in 2017, one of our grantees, an organization called Mountain Empire Older Citizens. They are a very rural area in Southwest Virginia, and they do a DialARide service. So all of their rides are reserved. And they realized that they also had folks, clients who were getting cancer care, people who had a regular dialysis appointment, and other folks with chronic care conditions that really just riding the bus was a strain for them, and they needed some support. And in some cases, they were able to bring a family caregiver or a friend with them, but in many cases they were not. And so what they did was they have a combination of paid staff and volunteers who ride on their buses. So they identify folks with these chronic care needs and when they need to ensure that an attendant is available. But there are many places around the country that have adopted practices where they have identified people who really cannot travel independently, and what can they do. But it's a tough issue, and it's not your typical practice in many public transit agencies. But something that on an individual basis or on a community basis really should be, could be a part of the conversation. With that, we were just about at 3:30, amazingly enough. I think that's the last question we have that's popped up in the chat box. I do want to remind everybody that we want to hear from you. Did this webinar, did you learn something? Did you find that it worked, met your needs? Do you have suggestions for other webinars or ways where we could improve this webinar? We would really like to hear from you. It's a very simple multiple choice questionnaire, but it does allow you to provide additional comments. So we hope that you will seize the opportunity to tell us what you think. And if you have additional questions, we welcome those. Those should come to contact@NADTC.org. And we thank you for your time and attendance this afternoon, and especially I want to acknowledge and thank our wonderful. With that, we'll sign off. Good night. Good afternoon, whatever.